Thank you for joining Cancer Support Community Atlanta for Survivorship, What Happens Next, facilitated by Kennon McCollum with Georgia Cancer Specialists. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Good afternoon, everyone. Welcome. And this is Emily Brown, the Program Director at Cancer Support Community Atlanta. Thank you for joining us today for this program on cancer survivorship in today's world of cancer care, presented to you by Kennon McCollum, an oncology nurse practitioner with Georgia Cancer Specialists. Kennon is donating his time today to do this program for us. He has done it for us before in the past and has recently updated his slides that prepared them for you today. So we're very grateful for Kennon doing this for us today. And without further ado, I'll let you go ahead and get started.
All right, well, welcome everyone to today's program. My name is Kennon McCollum. It's an honor to be able to speak to you guys this afternoon about cancer survivorship. I am a community oncology nurse practitioner with Georgia Cancer Specialists, and I practice on the south side of Atlanta in Stockbridge. And I really have had a passion over the last 10 years or so, really looking at cancer survivorship and kind of incorporating cancer survivorship into our daily practice here at Georgia Cancer Specialists. So I'm very pleased to be able to talk to you guys this afternoon about cancer survivorship. And we're really going to look at cancer survivorship in today's world of cancer. I think in our audience, we have a broad range of different people listening in and watching this morning. We have oncology providers. I believe we have some actual cancer patients in the program. We have caregivers, family members. So the purpose of this program is to really review with all of you guys who are attending today, really what we mean when we talk about cancer survivorship and kind of give the particulars of what is meant by survivorship care. The presentation will be kind of presented from the perspective of what we do day in, day out in our routine oncology practices across oncology practices, really around the United States. The idea of cancer survivorship and actually incorporating what we call survivorship care into oncology care really started around 2005. And what we're going to do is talk about really the evolution and the introduction of survivorship care into oncology practices throughout the US. So I think anytime you begin a discussion about cancer survivorship, we have to give a definition of what is meant by survivorship. There are a lot of definitions that are out there in regards to survivorship, but I particularly like this one definition, and it comes from the National Cancer Institutes, and they defined survivorship in 2014 as being one who remains alive and continues to function during and after overcoming a serious hardship or life-threatening disease. In cancer, a person is considered to be a survivor from the time of diagnosis until the end of life. The reason that I particularly really like this particular definition is because it gives the time frame of when a patient really becomes a survivor. I think survivorship begins at that moment that you're diagnosed with cancer. So once you have a diagnosis of cancer, from that moment forward, you are a survivor. Even after treatment and the conclusion of cancer, you still have been through the journey with cancer and you are a survivor of cancer, and you will be a cancer survivor until the end of life. So I like this particular definition because it defines the beginning of cancer survivorship as actually being at the time of diagnosis. What we know about cancer survivors in the United States is that the number of survivors year after year continues to increase. I think this is really good news in that if you look at this graph dating back to 1977, there were only about 4 million, a little shy of 4 million cancer survivors in the United States. If you look at the projection through the end of the year 2022, it's expected that we will have over 18 million cancer survivors by the end of the year 2022. The reason that I think that this graph really portrays good news in the cancer community is it shows us that people are surviving their cancer and are making it through treatment and continue to survive even long after cancer treatment. If you look at the particular graph, you can see the colored sections of the graph, and that top part of the graph, kind of in the light blue or the teal color, those represent the number of patients who are actually living more than 15 years out from their diagnosis. So as you see, year after year, the number of patients who are living 5 years after their cancer diagnosis, even 10 years after their diagnosis, and even 15 years after their diagnosis, those 15-year, 10-year, and long-term survivors increase year after year. So that tells me we have patients that are surviving their diagnosis of cancer, and their cancer survivorship is long-term, and it's going on as much as 15 or more years after the time of diagnosis. If we look at the trends for cancer survivorship and we look at the direction that we're heading, I think the news just gets better and better, that we have more and more people who will survive their diagnosis of cancer and will become cancer survivors. So by the year 2040, it's expected that we will have 26 million survivors of cancer. So you can see the yellow portion of this graph really shows the projection through the year 2030 and 2040. For me, when I look at this graph going up and increasing from the 1970s through the 2040s, what it tells me is as time goes forward, we get better and better at treating cancer. We're able to give cancer treatment, and beyond that cancer treatment, more and more people are surviving their diagnosis of cancer. If we look at male survivors of cancer, and this is data from the American Cancer Society from 2014, but I think it's relatively still pertinent here in 2021, it's no surprise that male survivors of cancer, the most common cancer out there that men are surviving with is prostate cancer. Prostate cancer being the most commonly diagnosed and most common form of cancer survivorship at about 43%. In the male population here in the US, colon and rectal cancer becomes the second most common at around 9%, followed by melanoma, bladder cancer, and the others. But you can see by far with males, the most commonly survived and most commonly diagnosed cancer is prostate cancer. So as you can imagine, our female survivors, still the most commonly diagnosed and the most common survived cancer is breast cancer. It accounts for around 41% of all female cancer survivors. Uterine cancer, around 8%, colon and rectal cancer, around 8%, and melanoma. So you can see some of the similarities between the men and women in terms of cancer survivorship, where we still see colon and rectal cancer being one of the top 3, melanoma being in the top 4. But for men, it is prostate cancer, and for women, it is breast cancer. Also, if we look at survivors by age group, you can see here on the graph, the largest percentage of people who are living and have survived cancer are in that age group of being 65 years and older. The second largest group of cancer survivors, which is represented by the orange portion of this graph, are between the ages of 40 and 60. We do have younger cancer survivors in that age group from 20 to 39, but as you can see here by the green portion on this graph, they make up a smaller percentage. So if we look across the US and we look at the largest number of cancer survivors, it is found in that age group of patients who are 65 years and older. When we talk about survivorship, the journey really began using the word survivorship back in 1985. And this slide really is a historical slide about really the beginnings of survivorship care. It's really attributed to a physician by the name of Dr. Fitz Mulan. In 1985, Dr. Mulan was diagnosed with prostate cancer. And as he went through his journey with prostate cancer, he wrote a paper about his cancer survivorship. It's really a classic and an iconic paper that was published in the New England Journal of Medicine in 1985. The title of his paper was entitled Seasons of Survival, The Reflections of a Physician with Cancer. And what he did in his journey with cancer is he basically identified what it was like to be a cancer survivor. And in that paper, he identified 3 separate distinctive phases of survivorship, or what we call the stages of survivorship. Dr. McCollum describes the first stage of survivorship as the acute stage. The acute stage of survivorship is really the time from the diagnosis of cancer through the end of treatment. So from the time of diagnosis until the end of treatment, that phase of survivorship is really focused on the actual cancer itself and everything that goes into the treatment of that cancer. But Dr. McCollum realized that once treatment is over, you then move into a different stage of survival, and that is known as the extended stage. The extended stage of cancer survival really starts at the end, and if the patient responds to treatment. During this period of survivorship, the focus of really survivorship moves towards really dealing with all of the physical changes that have happened as a result of cancer treatment, also the emotional changes, the psychological effects, and all of the aspects of the treatment of the cancer. So the acute stage is really about dealing with the actual cancer itself and providing treatment. The extended stage happens after treatment and kind of deals with the after effects of the treatment. And then finally, Dr. McCollum recognized that there's even an additional stage of survivorship, and this is called the permanent stage. And the permanent stage is really that long-term stage of survival that really begins once the physical, emotional, social, psychosocial effects of treatment have been dealt with, the side effects have been managed, and the patient really begins to get more of a confidence in continued health and really begins to try to return to the life that they had before cancer. So when we talk about survivorship, I think it's really important to understand that there are really 3 stages to survivorship. There's the acute stage, the extended stage, as well as the permanent stage. So what we know with survivorship, when patients undergo treatment and they conclude treatment, survivorship is really a battle of challenges. And those challenges are typically side effects that occur as a result of having the cancer treatment. What we know is that when patients undergo treatment, there is an expectation that once that treatment is over, the patient expects to return to a good quality of life following treatment. However, we know that cancer treatments, they often cause side effects, and those side effects can adversely impact the quality of life. So these chemotherapy or post-treatment side effects, they get divided into 2 categories. And it's really important to understand that there is a difference between the 2 categories. The first category of chemotherapy side effects or treatment side effects, we call those late effects. So the late effects of treatment, they typically occur after treatment, and they occur after treatment has been completed, but they are typically temporary side effects that last for usually up to 1 year. And usually by the end of the first year after treatment, the majority of late effects have resolved. But there are also long-term effects. Long-term effects, they occur after cancer treatment, and these are the effects that persist much longer and go on beyond a year. So when we talk about cancer survivorship and treatment side effects, late effects refer to those side effects that last for up to a year, and any side effect that goes on beyond a year, those are what we call long-term effects. We know that these side effects of cancer treatment, they can really affect any organ system. So any part of the body can be affected by chemotherapy survivorship issues. Here are some examples. We have, bone and soft tissue. We know that hormonal therapies for certain cancers sometimes can lead to osteopenia or osteoporosis. Cardiovascular systems can be affected, particularly in patients who receive drugs like anthracyclines, which we know can have an effect on left ventricular functioning of the heart. Dental and oral issues can happen, particularly in head and neck cancers who receive head and neck radiation. Endocrine, gastrointestinal. I think everyone thinks of gastrointestinal effects when you think of chemotherapy, because the first thing that comes to mind to patients is typically nausea and vomiting. You can have genitourinary changes. Hematologic changes can be decreases in blood counts, things like decreased white blood cell count, decreased red blood cell count, or even decreased platelet count. You can get hepatic or liver symptoms. The immune system can be affected. There's decreases in patients' immune functioning. Skin, you can see things like rashes. You can certainly have musculoskeletal, nervous system, neurocognitive, and in the world of survivorship, there's a common phraseology that we use called chemo brain. We know that patients who undergo chemotherapy while they're on chemotherapy can sometimes have issues with short-term memory and things like that, kind of fogginess to memory. It's a temporary effect, but we know it can go on during chemo, and it can last for anywhere from 3 to 6 months after chemo. So in survivorship, neurocognitive changes are common and are often referred to, as what we call chemo brain. Ophthalmology changes, pulmonary changes, renal changes, and even reproductive changes. Reproductive changes being particularly for young individuals treated with cancer who may be concerned about fertility and infertility as a result of cancer care. So if we continue discussion about survivorship challenges and really talk about side effects of cancer treatments, we know that cancer treatments, they really have a wide range of both late and long-term side effects. The side effects of cancer treatment really depend upon multiple factors. Certainly the age of the patient at the time of treatment, also the length of time of treatment. Is it a short-term treatment or a long-term treatment? And we know that side effects, they're really dependent upon multiple different factors. One of the first factors is the modality or the type of treatment that is used. In today's world, we treat cancer with various different modalities. You can certainly treat cancer with surgery. You can utilize radiation. You can utilize what we call cytotoxic chemotherapy, which is your traditional type of chemotherapy. In today's modern world, we've moved more towards immunotherapy. You can certainly have hormonal therapy. Since the late 1990s, we've moved more and more towards targeted therapy, and targeted therapies are therapies really specifically targeted to particular tissue types or receptors where it's not quite so devastating on normal cells. Now we're moving into a whole new area of cancer treatment as we move into gene therapies and really highly sophisticated therapies. So really side effects depend on which modality is used. Certainly when surgery is used, it makes sense that when you have surgery, you certainly can have body image and permanent body alterations. The examples that I come up with are things like the woman who undergoes a mastectomy and may have alterations in chest wall and breast, patients who have rectal cancers and colon cancers who may end up with a colostomy. So you certainly can see body image and permanent body alterations as a result of surgery. Also, chemotherapy side effects, they're really drug specific and drug class specific. Each of the types of drugs that we use to treat cancer, particular classes of drugs, they may have specific side effects that go along with them. I've just named a few. Here's examples. A very common drug that's used to treat cancer is a group of drugs called the taxanes. We know the taxanes can lead to symptoms such as peripheral neuropathy, anthracyclines, drugs like doxorubicin, epirubicin, and drugs like that. They can cause cardiac changes. Targeted drugs, what we call EGFR drugs, can cause things like rash. These are just examples of how different drug classes may cause different side effects. I think also side effects are really dependent upon the amount of chemotherapy you get, meaning the dose of chemotherapy, and also the length of the treatment. We know that in some chemotherapy protocols and regimens, the treatment can be very short term. They may only last weeks to months. But in patients with metastatic disease or advanced stage disease, treatments can last longer, and in some cases, treatments can even last indefinitely. What we know is that many of the side effects related to drugs, they're what we call dose dependent, meaning the longer you're on the drugs and the more exposure you have to those drugs, the more likely those drugs are to cause side effects. Additionally, side effects from chemotherapy really look at whether or not we combine different modalities or different treatments. It's very common practice to give chemotherapy in combination with radiation or chemotherapy in combination with immunotherapy or certain chemotherapies in combination with targeted therapies. When you start to give, different modalities in combination, you can certainly have additive effects, and they kind of bring their own layer of side effects. So when we talk about these survivorship challenges and we talk about side effects, you really have to look at the big picture, and you have to look at the modality, the specific drug, the drug class, the dose, the length of treatment, whether or not combined modality was used, the age of the patient at the time of diagnosis, and also the patient's comorbidities to really get a sense of what the side effects may be. In addition to just physical side effects from cancer survivorship, I think it's really critically important to understand that cancer treatment not only affects the physical well-being, but it also affects all the other dimensions of quality of life. So cancer survivors, not only are they dealing with physical and well-being symptoms, they're dealing with psychosocial problems, social well-being, and spiritual well-being. I think the physical well-being and physical symptoms of cancer care, they're fairly obvious. We know that cancer care can interfere with functional ability, a lot of fatigue, sleep, rest, nausea, appetite, all those things you can think of with cancer treatment. But a very big aspect of cancer treatment and cancer survivorship that I think always needs to be looked at and incorporated into cancer care is also taking care of that patient psychologically. When we talk about cancer survivorship issues in a psychological dimension, a lot of it is centered around control. When you are a newly diagnosed cancer patient, most people are familiar with taking care of themselves and having a sense of control. And then all of a sudden you get thrust into cancer treatment where you're being told you have to be at an appointment at a certain time, you have to show up at the office at a certain time, you have to take certain drugs, and you really go on to someone else's schedule, and that schedule is dictated by your treatment. So there's often a sense of loss of control that you're no longer in control of your own schedule or timing when you get diagnosed with cancer and undergo cancer treatment. Certainly patients experience anxiety and depression. The physical aspects of cancer treatment can interfere with basic enjoyment and leisure of life. I think one of the biggest aspects of psychosocial well-being in the cancer survival realm is the fear of recurrence. Once a patient is diagnosed with cancer and has the diagnosis of cancer, even after treatment, there's always an ongoing fear of recurrence. And I think it really imparts on us as oncology providers to address all of these psychological aspects of care when we do survivorship care. Like we said before, cognition and attention changes can happen as a result of chemotherapy. And then there's just general distress that goes along with having the diagnosis and undergoing everything that it takes to make it through cancer treatment. So that's psychological well-being of the patient. But there's also what we call the social well-being dimension of quality of life. This involves really others involved in the cancer patient's life and journey, things like family distress. Cancer survivorship can certainly have an effect on changing roles and relationships. Someone with cancer may have been, the primary role of the home, and that may get flipped, and roles and responsibilities fall to other members of the family. It can certainly affect affection, social functioning. There's worry about appearance, life enjoyment, the feeling of isolation. And I think the big one in the social well-being sphere is it certainly interferes with finances and work. Patients, when diagnosed with cancer and going through cancer treatment, who are on a regular work schedule, often have big changes to their ability to work on a daily basis and continue their current work schedule. And that leads to financial distress. It sometimes can impact income, and there's worry about being able to maintain job and income. I think one of the biggest dimensions of quality of life that we really need to do even better at than we're currently doing with cancer survivorship is addressing spiritual well-being. When patients are going through cancer and cancer treatment, there's a lot of questioning about the meaning of their illness, a lot of questions of, why me, how me. There's issues related to religion, transition, transcendence, hope. There's uncertainty and questioning the existential meaning. So I think in order to deliver cancer survivorship care, it should not focus just on physical symptoms and side effects alone. You have to incorporate all of the dimensions of quality of care. So an effective survivorship program addresses physical changes, psychosocial changes, social changes, as well as spiritual changes. So this is some interesting data done around the year 2011. This was when Lance Armstrong Foundation, Livestrong Foundation conducted a poll. They polled over 1,020 patients who were considered to be cancer survivors, and they basically asked them what were common themes or common thoughts that they had regarding their treatment with cancer. So 53% of patients in this poll reported that they had secondary health problems as a result of their cancer treatment. 54% of patients in the poll said they had issues with ongoing and chronic pain as a result of their cancer treatment. A third of patients had issues with fertility. If we look at non-medical support, 49% of patients felt like their non-medical cancer needs were unmet during their treatment. So for me as an oncology provider, that's an astounding number, that nearly half the patients basically said in this survey that their medical needs were being addressed, but perhaps their non-medical needs, such as psychosocial needs, social needs, and spiritual needs, were unmet during treatment. 53% of patients stated that things like practical and emotional consequences of cancer were often harder to deal with than medical issues. So more than half the participants in the survey said that essentially they could deal with the physical aspects, but they had more difficulty with the psychosocial, social, and spiritual aspects of cancer care. 70% of patients in this survey said they dealt with depression as a result of cancer and cancer treatment, but 78% of those did not seek any professional services for emotional concerns. So for me as an oncology provider, this tells me that yes, the psychosocial part of cancer care is real for patients, and there are a lot of patients that would really benefit from interventions and professional services to help with emotional concerns. 58% of patients in this survey, they dealt with a loss of sexual desire or sexual functioning as a result of cancer treatment. So this poll just really kind of opens our eyes as to the types of things that we need to incorporate and be addressing when we do survivorship care. So if we look at other parts of this Livestrong survey, if we look at the financial aspect of cancer care, 43% of patients reported that they had a decrease in their income as a result of going through cancer treatment. 25% of patients said that they went in debt as a result of their treatment. And there were about 12% of patients that actually turned down a treatment option because of concerns over the cost of that treatment. There were 32% of patients in this survey that said that they missed out on the opportunity for an advancement at work, or they missed a raise or a promotion. And 32% of patients said they actually went through a demotion or a loss of job. Interestingly, there were 34% of patients in this survey that felt like they were trapped in a job just to preserve insurance coverage to make sure they maintained coverage for their cancer treatment. So if we talk about survivorship and we put it in perspective of the entire cancer continuum, the continuum of cancer care, it really begins before the diagnosis of cancer. It goes to really things that we try to do to prevent and reduce the risk of cancer. For years, we've been talking about, smoking cessation, diet and exercise, eating healthy diets, trying to stay out of the sun and sun exposure, limiting alcohol use, getting immunizations against certain cancers. The example that comes to mind is the human papillomavirus vaccine that, when given, can prevent a lot of the HPV-related cancers. And we've also done chemo prevention and early stage diseases like ductal carcinoma in situ, which is precancerous conditions. Sometimes we can give medications to prevent it from turning into a full invasive cancer. So there's been a lot of activity in prevention and risk reduction. I think the second part of the cancer care continuum is really screening, and screening is often driven by factors such as age, gender, ethnicity, and this goes to things like mammogram screening, colonoscopies, PSA testing, genetic testing and really being able to identify cancers either in their early stage or trying to catch them before they have significant progression. So the cancer care continuum really starts with prevention, risk reduction, and screening. But you'll notice the purple arrow here on the cancer care continuum, and that is really the time period in which cancer survivorship occurs. As you can see, cancer survivorship really happens at the time of diagnosis. In the diagnosis section, you can see all the things that happen there in terms of the newly diagnosed patient. And really in the cancer survivorship continuum, survivorship should begin at the time of diagnosis. So really care planning for survivorship should happen right at the time of diagnosis. Psychosocial support should be provided right at the time of diagnosis. Cancer care in terms of survivorship really begins at the time of diagnosis. You can see the green arrow down here at the bottom, and the green arrow really kind of gives us those phases or those stages of survivorship that we discussed early. So that acute care or acute phase of survivorship really is during diagnosis and treatment. Once treatment is concluded, then we move on to that extended phase of survivorship until ultimately we move through the late stage, and then ultimately through the patient's lifespan, we move towards end of life care. So you can see in each of these parts of the cancer care continuum, different things are happening. You can see in the survivorship portion, we're really focused on surveillance for recurrence of the disease, screening for other types of related cancers, looking for hereditary cancer predisposition, looking at genetics, and it really ultimately moves through the full cancer continuum. So these are just some facts or best practices, if you will, that we talk about with cancer survivorship care. And we look at really how cancer survivorship is typically being done on a daily basis in usual oncology practices. We know in oncology practices that follow-up care, it's usually done by the oncologist, and that includes oncology providers such as nurse practitioners and physician assistants. Routine follow-up care should be routine, and it's done on a daily basis in all oncology practices. But when we talk about follow-up care after treatment, that is different than survivorship care. Follow-up care typically focuses on disease surveillance to ensure there's no recurrence of the cancer. And it's important to understand that routine follow-up care is very different than survivorship care. Survivorship care really should be done in addition to routine follow-up care as part of the cancer treatment continuum. So in a thriving oncology practice that is doing both follow-up care and survivorship care, that post-treatment survivorship care is typically done in addition to and along with follow-up care as part of that cancer treatment continuum. In practices that are utilizing survivorship and incorporating survivorship care, patients often report that they find it very reassuring and that they find a lot of value in receiving survivorship care. Also, the duration of follow-up care and survivorship care, it is very variable from one oncology practice to the next. That is one thing that we're trying to get better at, and that's trying to provide more standardized survivorship care so that there is some continuity between practices. But in today's current world, different practices perform survivorship care in different ways. In an attempt to try to make survivorship care more standardized and more part of a daily practice, in the year 2005, that's when we first saw the introduction of guidelines and protocols to conduct survivorship care. We're going to talk about that in just a minute. But what we know is that these guidelines and protocols, they're often limited, and they're fairly new in the grand scheme of cancer care. They've only been around for about the last 15 years. Also, with cancer care, there has typically been a very limited transfer of knowledge and information from the oncology providers to the primary care providers. And time again, primary care providers have really voiced that they're not familiar with survivorship and survivorship follow-up requirements. And primary cares have really vocalized that they need direction from the oncology care team in terms of how primary care providers should be doing surveillance and imaging and testing, and what those requirements are for each of the different cancer types. So these are all kind of caveats about survivorship care, and each one of them represents an aspect where we can improve and incorporate survivorship care to address each of these issues. What I think this really boils down to is if you're an active oncology practice and you're providing survivorship care, if you provide that patient with a cancer survivorship care plan, that care plan can really address a lot of these concerns. So that brings us to the historical perspective of survivorship. If we look backwards in time, you can see that there's been several federal initiatives to really institute survivorship care. You have a national action plan for cancer survivorship called Advancing Public Health Strategies that was produced by a collaboration between the CDC and the Lance Armstrong Foundation. In 2003, you had Living Beyond Cancer, Finding a New Balance, which was really a presidential initiative from the U.S. Department of Health and Human Services. But if you really look at really the birth of cancer survivorship care, it really goes back to 2005. And in November of 2005, the Institutes of Medicine, in collaboration with the National Research Council, they produced a document or a position paper, if you will, entitled From Cancer Patient to Cancer Survivor Lost in Transition. This was a real pivotal time in cancer care because this was the first federal initiative that really talked about survivorship and really put mandates forward that all practices performing oncology care should really put in guidelines and protocols and incorporate a separate survivorship care from routine follow-up. So it really, I call it the birth of cancer survivorship, really evolved after November of 2005 due to this position paper. So this Institutes of Medicine report that came out in 2005, they actually placed really federal mandates for requirements for the delivery of survivorship care. First of all, it required all oncology practices to prevent some type of survivorship care plan or engage in some type of survivorship care activity. It really required that survivorship care plans include information that bridges that information gap between the oncology provider and the primary care provider. It encouraged oncology practices to really begin to test models and models of care for survivorship. The Institutes of Medicine report really has developed national guidelines. These national guidelines for cancer survivorship have included quality assurance measures, and it's also strengthened a lot of education and professional education around survivorship. It also mandated that oncology practices make better use of psychosocial and community support services. So it helps to integrate outside facilities and services into survivorship care. It also mandated that any survivorship program address employment, insurance, and financial issues related to the patient in cancer care. And what it's done is really encouraged a lot of investment in survivorship research. So since November 2005, there's been a lot of forward progress in providing survivorship care. So really, they put out guidelines, if you will, for how to do long-term follow-up for survivorship programs. And they really identified various needs that need to be addressed. The Institutes of Medicine recognize that there is a real need to figure out how we can deliver survivorship care to a large number of individuals. And I think that takes us back to that graph that I showed you earlier, where by the year 2040, it's expected that we'll have 26 million cancer survivors. So the Institutes of Medicine really recognize that there will be more and more patients dealing with cancer survivorship, and they really have put out the call to figure out how to care for these large number of individuals. The IOM report also asks practices to really gain a much better understanding of the consequences of cancer care and its treatment. They put a focus on the application of interventions that would eliminate and reduce some of the effects of cancer treatment. So since 2005, there's been a lot of initiatives that really look at how can we either eliminate or reduce some of the side effects of cancer. It really launched us into a platform for research in terms of survivorship. And since 2005, there's been a real shift in focus to really educate oncology professionals and train oncology professionals on how to deliver survivorship care. So in their model, if you will, from the Institutes of Medicine, from this position paper, they essentially created a model that survivorship programs are supposed to follow. And it really focuses on coordination of care. One of the first mandates is that all survivorship care should include coordination of care between the patient's oncologist, the patient's primary care physician, and any other healthcare provider that was in that patient's care. It also mandated, second, that all patients at the conclusion of their cancer treatment should receive a summary of the treatment. And that summary would be accompanied by a survivorship care plan. When we talk about a survivorship care plan, it's really the mandate that every patient, upon the conclusion of their treatment, they receive a written summary and review of what they were actually treated with, and that should include a survivorship care plan. The survivorship care plan is, I guess, the best analogy. It's a roadmap. It provides the patient and the associated providers with a care map for what should happen at 3 months after treatment, 6 months, 1 year, 2 years, 5 years. And it's really a map of all the things that need to be done to care for that patient after treatment. It should also include surveillance guidelines. So depending on the type of cancer it is, there should be a plan for when CAT scans should be done, when colonoscopy should be done, when mammograms could be performed. So the idea is that coordination between all of the parties involved, everyone would be familiar with how that patient is treated, what the roadmap is for care, and what the surveillance guidelines are to really assess for any recurrent cancer. These care plans really focus on 3 different areas. Number 1 is prevention and detection. When we talk about prevention and detection, it's talking about how do you promote healthy behaviors after cancer treatment to make sure that you don't have recurrence of cancer. They have a real focus on increasing physical activity, diet, appropriate eating, maintaining ideal body weight, things like tobacco cessation, sun protection, and then screening procedures. You know, how often do you get a colonoscopy? How often do you get a mammogram? How often do you get a CT scan? Then surveillance. Surveillance is really all the clinical aspects of how you do assessment for recurrence. And included in that surveillance piece, you have to do surveillance for any late effects from chemotherapy and long-term effects. And you really have to have a plan for how you deal with those late and long-term effects. And then finally, the other piece of this care plan should include interventions for psychosocial, physical, social, and spiritual. So it really puts the task out there to address all of those dimensions of quality of life that we discussed earlier. So the way that this is done in adult cancer survivorship programs, you can have 1 of 2 models for survivorship care. A lot of practices may use a disease-specific protocol. So you may have a survivorship protocol depending on the type of cancer that you're dealing with. For example, a colon cancer survivorship protocol, breast cancer, or lung cancer. And I think most of these survivorship models follow what we call the comprehensive model. The comprehensive model for cancer survivorship really involves 2 stages. You have what's called the consultative model first. That is a one-time visit that really focuses on what the cancer treatment was, providing that patient with a cancer treatment summary, and really providing a systematic plan for how you're going to do cancer surveillance. But I think most practices combine that with what we call the ongoing care model. And that really extends the cancer care continuum and continues to incorporate survivorship care into each and every visit that happens with that patient after they complete their treatment. So I think it's really critical at the end of treatment for a patient to have that initial consultative visit, and then to incorporate going forward survivorship into all subsequent visits. So if we look currently at survivorship care models in the community care setting, we know there's different models and that they vary from practice to practice. The one thing that should be in common is no matter where patients receive survivorship care, they should always be provided with the survivorship care plan. The care plan is really that roadmap that I talked about, and it is critical for doing survivorship care. All survivorship care plans, they should include information about the diagnosis. It should include the date of the diagnosis, the cancer type, which includes histology, as well as staging and location of the cancer. The cancer care survivorship care plan should have information about the treatment, particularly what treatment was given, what was the schedule in which that treatment was given, and it should also include any dose modifications that were made to that treatment care plan. There should be information about both late and long-term side effects included in the survivorship care plan, and that survivorship care plan should not only address physical symptoms, but it also should have an aspect that deals with social changes, psychosocial concerns, and spiritual changes as well. So an effective survivorship care plan, it really should include a plan for both short and long-term follow-up. It should include a plan for management of both late and long-term side effects. Very importantly, it should coordinate care amongst different providers. It should be shared with the patient's primary care physician and other specialists. It should include practice and community resources for care, and a lot of those community resources assist and help with psychosocial and social issues. There should be a clear-cut plan for disease surveillance, and it should also very clearly delineate what are the responsibilities for the primary care provider and for the oncology provider. That was a theme that was really voiced from the internal medicine community, where they said, we're not the experts at knowing how to surveil for different cancer types. So in a survivorship care plan, the internal medicine community really wanted a clear-cut plan based upon the disease state, what their responsibility was for surveillance and what was the oncologist's responsibility for surveillance. And most importantly, this information should always be shared amongst all providers involved in the patient care, and a copy should always be given to the patient. So it's all about communication. So with survivorship care, it's all about coordination of care, making sure that the information in that care plan is shared, make sure that patient does receive a treatment summary. So part of that care plan includes a treatment summary. That treatment summary should have, all the information we discussed before, but it should also have a record of any surgery or radiation or chemotherapy that was given. It should clearly document any event that occurred during treatment that might need future follow-up. Again, it talks about late and long-term side effects and a clear plan for surveillance. So really, if we have any cancer survivors out in the audience participating today, if I could just send one message to those patients who are cancer survivors, these are some things that I think are really important about survivorship. Number one, if you're a cancer survivor, be aware that survivorship planning and survivorship care should and really is and should be part of your treatment plan. It should be offered to you by your oncology provider. I would encourage any cancer survivor to not be afraid to ask your provider about what will be offered to you in terms of survivorship care. The easiest way to do that is just point blank ask your provider, can you give me a survivorship care plan? Be informed and ask your provider about what type of physical symptoms should be part of your survivorship plan. Make sure that your oncology provider includes your primary care physician and any other physician you see in your survivorship care plan. And I think really important is don't be afraid to discuss any physical symptom that you need addressed in your survivorship care plan. Talk about any social issue, talk about any psychosocial issue, and ask your provider about any spiritual concerns that you have as a result of your treatment. And then ask your provider to include those as part of your survivorship care plan. And then I think as an advocate for patients, one of the things that I think patients can do is educate yourself about cancer survivorship. Take some time to ask for materials, do some, homework and education about cancer survivorship, and just be prepared to talk with your oncology provider about survivorship will be done in your particular case. So I think that gets us through our program. I think we have about 10 minutes left for questions and answers, but I just wanted to put up some helpful resources, and perhaps Emily can talk a little bit more about the cancer support community in Atlanta. So the cancer support community in Atlanta, they offer free virtual support services for those affected by cancers. That includes things like live virtual support, things like stress reduction, exercises, nutrition, educational programs, support groups, cancer support community, and I think it's cscatlanta.org. And if Emily wants to talk more about cancer support community, I'll just turn it over to her to so she can tell you more about the cancer support community.
Yes, thank you so much, Kennon, for a wonderful presentation. Yes, I did want to make sure that we highlighted resources available through the Cancer Support Community Atlanta. Again, I'm Emily Brown, the program director. So we do offer these monthly education program as well as all of our regular support groups. We invite you to check out all the support groups we offer at cscatlanta.org. We have support groups for disease-specific cancers, and we site-specific support groups, as well as support groups for caregivers, as well as support groups for those who are bereaved and have lost someone from cancer. So please check out our website if you're interested in joining our support groups, or email me at emily@cscatlanta.org, and I'd be happy to get you connected. I did want to let you know that we are having another education program in 2 weeks. From today, it's Frankly Speaking About Clinical Trials. That'll be Friday, December 3rd from 12 to 1. So if you'd like to join us for that, you can register on our website. And Kennon, I think we did have a question in the chat box. For those cancer survivors that have lost jobs, decreased employment, and loss of financial independence, what are some resources that can be accessed to help?
Yes, I see that question here, and I was just thinking about that question. And I think probably the easiest way I can answer that as a nurse practitioner is just about every oncology practice out there has access to oncology social workers. I know here at Georgia Cancer Specialists and at Northside, there are specially trained oncology social workers. I think social workers are and should be involved in every patient going through cancer treatment. And I think they are a wealth of information about these resources. You know, I'm not the expert in exactly what these resources are, but I would encourage anybody to get in touch with the oncology social worker involved in your care, and they are certainly a wealth of information on exactly what resources are out there. Is that a good answer for you guys? And I think that is tap into the resources from the oncology social worker involved in your care.
Absolutely, I echo that sentiment. If anyone else has a question, feel free to submit that in the chat right now. A couple people have asked about the recording today. Yes, we are recording this program, and it will be posted on our website, cscatlanta.org, in the coming weeks. We just have to download and edit that, so it might take a week or two to get it up, but it will be available. And I'm also going to share the slides from the presentation in the chat. Kennon has graciously agreed to share those. So I will go ahead and send those in the chat. And if anybody has any questions, please go ahead and submit them. I think the last slide you showed. Oh, is someone speaking?
Yes, this is Alice from Romagilo.
Yes, hi Alice.
I have a problem in that, hey, I was my third OB gynecologist. I mean, what do you call it? Gynecological oncologist, because Emory bought my hospital in the meantime, right after my treatment. But my question is, at my next appointment, I will have reached 5 years. And my doctor did mention that I will need to find a regular OBGYN. Does that mean that he's releasing me, or should I have some kind of follow-up?
You know, That's a great question, and a lot of it depends on the type of cancer and what the specific NCCN guidelines are for follow-up. The NCCN guidelines are the National Comprehensive Cancer Network, and they actually have disease-specific surveillance guidelines. Typically, those guidelines for most of the cancers are kind of that care map that I talked about, years 1 through 5. Depending on the type of cancer you had and the incidence of recurrence, it gives a specific thing what should be done years 1, 2, 3, 4, and 5. And it sounds like your particular cancer type, that your GYN oncologist feels like that the NCCN guidelines really end surveillance at 5 years. And if he's recommending you just follow up with a regular OBGYN, that probably is the end of the recommended surveillance. And it sounds like your GYN oncologist is comfortable just turning the follow-up care after that over to a regular GYN.
Thank you very much.
You know, maybe ask him that question at your next visit, you know, say, is this everything I need for surveillance? Have we gone through that NCCN full care plan, and are we at the end of it? And you know, ask the question, is there anything that I need to share, or can you share with my regular GYN what needs to be done beyond 5 years?
So I can ask for a survivorship plan at that time?
Exactly. You know, just ask him, say, can I please make sure that I get a treatment summary, which includes everything I was treated with? Can I please have included in that what your plan of care is for survivorship care? You know, what we need to do years 5 and beyond.
Thank you. That's great.
Certainly.
Thank you, Kennon. You've highlighted something that has come up a lot in the support group that I do, that it's very important for patients to be their own advocates when it comes to their health care and to speak up for any need that they have. They know their health the best, and having those conversations, and like you said, advocating to get that survivorship plan is so important.
Yes, I totally agree with that. The word survivorship is something that has kind of moved forward over the last decade, and it's gaining in momentum. And I really love the fact that cancer patients are now starting to use the word survivorship. So I always say, advocate for yourself as a patient and use the word survivorship. You know, say to your provider, now that I'm off of treatment, I need a survivorship care plan, and specifically ask them to give that plan. And I think the more that patients advocate for that and ask for that survivorship care plan, we'll see more and more providers getting more comfortable with actually creating those plans and sharing them with their patients.
We had another person ask about finding exercise classes in the evenings for breast cancer survivors. I know that we do offer a yoga class at 4:30 every Wednesday. If you're looking for something later, though, we have all of our exercise programs are recorded and on our website to be viewed at any time. So those are always available to you at cscatlanta.org under videos for you to view whenever is most convenient, or we have our live classes at the designated times. If there's no other questions, Kennon, do you have any closing thoughts?
Yes, you know, I guess Emily called me the survivorship guru in the beginning, and that's because when I did my doctorate of nurse practitioner, I did my focus in survivorship. And I can tell you, before I really began to study about survivorship, I didn't really understand the concept of survivorship. And I think there's a lot of providers and patients out there that are still learning survivorship, because it's a fairly new concept in the oncology world. And I think if we work together and patients advocate, like we said before, and ask for survivorship initiatives and make themselves educated on survivorship initiatives, it helps us as providers to really learn how to deliver that care and provide that care. So I just think it's a good idea for all the providers on the line today and all the patients on the line today to really think about survivorship and think about what we talked about today. And if you're treating a patient for cancer, think about how you're going to provide them with that survivorship care plan. And if you are a patient who's getting towards the end of treatment or have finished your treatment, figure out how you're going to ask your provider for what your survivorship care plan and survivorship care needs might be.
All right. Well, thank you so much again for doing this program for us and bringing us new information on survivorship. We're so grateful for you for doing this. We had another message, just people saying how much they've enjoyed this, how much they've learned over the last hour that they can take home with them. Wonderful. We appreciate hearing that from you. Someone asked, what is NCCN again?
I see a question there. Yes, that stands for the National Comprehensive Cancer Network. And you can just open any web browser and just type in NCCN or National Comprehensive Cancer Network, and it will launch you to their site.
And I have put the slides for today in the chat. They're taking a minute to download, so I'm going to leave the chat open for anyone interested, or just email me, emily@cscatlanta.org, and I will happily share those with you as well. All right, but I know, Kennon, you are in clinic, so I don't want to take up too much of your time. Thank you, everyone, for being with us today. I'll leave this open so that we can get the slides in for anybody who's interested in those, but I'll let you go ahead and go. Thank you again. It was a wonderful presentation.
Thank you, everyone. Thanks.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.